According to a new CDC study, schools without mask mandates are more likely to have COVID-19 outbreaks. Researchers found that counties that had no mask requirements in their schools had a higher rate of pediatric COVID cases after the school year started than those that do have requirements. Dr. Schieffelin from Children's Hospital joins us this morning to explain why masks are such an important tool in helping prevent the spread of COVID in schools and keeping kids physically in classrooms. Doctor, good morning to you.
Good morning. Thank you for having me.
So you and I got a chance to chat before we got on air here, and you were telling me that the CDC just completed 3 different studies regarding kids and masks and schooling. Tell us about those studies if you can, and what the results were.
Sure. So as you said, they did 3 different studies in conjunction with different states' Office of Public Health and different universities. The first one was specific to Arizona, and they looked at 2 different counties, one with a mask mandate at the beginning of school, one without a mask mandate, and they found that those with a mask mandate were 3.5 times less likely to have outbreaks within their schools. So that was a great demonstration that there's a big advantage to having mask mandates keeping kids in schools. The second study looked sort of more nationwide at what was in place at the beginning of the school year. Even though we've had a lot of different school closures, and up to almost 1 million kids have had to stay home from school, actually what it really showed was that we've done great, everything that the school districts have put in place, everything from social distancing, hand hygiene, masks, those have really worked to keep kids in school. And then the third one just showed that schools looked more specifically at counties that had school mask mandates at the beginning of the school year compared to those that didn't. And in those school districts that did have mask mandates, they had many fewer pediatric cases of COVID. So the mask mandates were keeping kids safe in those districts.
And Dr. Schieffelin, I know in our area, we've had a lot going on here, of course, the hurricane. But before the governor did put an indoor mask mandate in place. You had a lot of school districts that also added a layer of adding testing options or testing availability to students and teachers, even some having vaccination drives. I know we're kind of trying to get back into the swing of things. Kids are just getting back in school. But before the hurricane, were you all seeing that those efforts were working and keeping kids in the New Orleans area, in Southeast Louisiana safe? Because otherwise you'd be seeing them at your hospital, correct?
Right, that's exactly right. So certainly in July and the beginning of August, we had a really high number of pediatric COVID cases. Those numbers just before the hurricane were fortunately coming down. We're still seeing that sort of sustained decline. We're very happy about that, and I think that's attributable to all the things that people have been doing, wearing masks indoors, vaccination, of course, and social distancing.
So hopefully if those schools that are going back keep up those efforts and those mitigation efforts, we can keep seeing those cases decline, especially in kids who can't even get the vaccine just yet. Dr. Schieffelin, we appreciate your time and your insight this morning.
Great. Thank you very much. Have a great day.